Welcome to Cardiopulmonary Resuscitation Online Training Program. Cardiopulmonary resuscitation is the first aid procedure used to restart breathing. If a person is unconscious and not breathing, we perform CPR. CPR is chest compression plus breathing. The ratio of CPR is 30 external chest compressions plus 2 expired air resuscitation. Complete 30 compression on chest in 15 seconds, and 2 rescue breaths in 5 seconds. One cycle of CPR is 30 compressions plus 2 rescue breaths in 20 seconds. Complete 3 cycles of CPR in 1 minute. Continue CPR till breathing returns. Stop CPR when breathing restarts, when medical help or ambulance arrives, or when you are too tired. Before performing CPR, make sure it is needed. First, we do a primary assessment to make sure if the breathing is present or not. To do a primary assessment and subsequent actions, we follow D, A, B, C plus D. D for danger, check and remove danger, or remove the victim from the danger. R for response, check for response if conscious or unconscious. To check, tap on the shoulder or talk to the victim. A for airway, open airway. To open airway, tilt the head backward. For spinal injury, use jaw thrust method. B for breathing. Check if the breathing is present by look, listen, feel for 5 seconds. If breathing is absent, give 2 initial rescue breaths and start CPR. C for compression. CPR is started by chest compression. Continue CPR, cycle of compression and breaths till the breathing restarts. If the breathing restarts, put the victim in the recovery position as shown in the figure. D for defibrillation. During CPR, if the AED machine is available, use it and follow voice instructions. First, introduce yourself and take permission to help. Ask what happened. Check and remove any danger. Check response, if victim is conscious or unconscious. If unconscious, call for medical help or tell someone to do so. Inform location, case and condition of the victim. Put on personal protective equipment like gloves and face mask. Roll the victim sideways and open airway. Don't do this if you suspect a spinal injury. Open victim's mouth. If any food or vomit present, clean it by finger swipe method. Move the tongue aside. Look, listen and feel for 5 to 10 seconds to check breathing. If breathing is not present, give 2 initial rescue breaths and start CPR. Perform 30 chest compressions in 15 seconds. Give to rescue breaths in 5 seconds. For adults, compress 4 to 5 centimeters using both hands. Give 2 full breaths for adults. When the breathing starts, put the victim in recovery position. For child, compress 2 to 3 centimeters using one hand. Give approximately half breath twice. For infant, compress 1 centimeters using 2 fingers. Give gentle puff with your mouth covering both mouth and nose.